guys, welcome back to Medical Coding with Blue. Today's episode is all about the CIC, or the Certified Inpatient Coder certification. If you are brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, so AAPC, or the American Academy of Professional Coders, has their flagship credential, which is the CPC, or the Certified Professional Coder. This says that you know how to code outpatient. This says that you know how to use the ICD-10-CM manual, the CPT manual, and the HCPCS Level 2 manual, okay? Then they have the Certified Inpatient Coder certification, right? So this says that you know how to code with the ICD-10-CM manual, the ICD-10-PCS manual, and that you know how to code for hospitals, like inpatients in a hospital, and you know how to code for facilities, okay? So that's the CIC. These are two completely different credentials all on their own, right? And so if you know how to code for the outpatient, people will go with the CPC. If you've been trained and you know how to code on the inpatient side of the house, some people will attempt the CIC. It depends on where you want to code for, okay? So I'm gonna read the comment and then we're gonna get into the episode. So the comment says, can you certify for inpatient coder without having a CPC? And is it still easy to find a job without a CPC if you have a CIC only? So the first question that they asked is, can you certify without having a CPC? The CPC is a flagship credential with AAPC. A lot of people will start with the CPC, but according to a discussion board that I read earlier from the AAPC website, you don't have to. You can start off with the CIC if that's what you want to do, okay? Now, to the second part of the question, which is, is it still easy to find a job without a CPC if you have a CIC only? First of all, it's not easy to find a job in medical coding. That's first of all. Secondly, if you have a CIC, this means that you are going to be applying for inpatient positions. If you are trying to apply for outpatient positions and you only have the CIC, they may kind of look at you like, well, do you know how to code for outpatient? So if you have on your resume that you know how to code for the outpatient, meaning that your skills extend to the CPT manual as well, and then you explain this, when you're applying, then they may give you a chance. Say, okay, well, they have only the CIC, but we're going to give them a certain amount of time, 6 months or a year. Somebody said they got 2 years to be able to get their certification, okay? So it really all depends on the employer, how they're willing they are to work with you. So if that's the case, then that's just something that you may run into if you're applying for outpatient positions. But clearly, if you are really dedicated to starting with the CIC, you really want to kind of stick with applying for those inpatient medical coder positions, okay? So I'm going to go ahead and read from the AAPC website, and I will leave this link for the CIC in the description box below. It's important that you guys know what these different credentials are for. Yes, while I am not a big advocate of brand new medical coders getting more than one certification in the first 2 years, if you get your CPC and then you say, hey, I want to code for the inpatient side, let me get the CIC, because you want to stay with AAPC. That is totally fine. And I'm cool with that, because that makes sense to me in my head. The CPC and the CIC are two completely different things. The CPC is not testing you on the things that the CIC will be, okay? So that's where that's okay. So again, if you want to just start off with the CIC, that's totally fine, but just know that that is for those inpatient positions, okay? So from the AAPC website, the Certified Inpatient Coder, the Inpatient Medical Coding Credential, Certified Inpatient Coder CIC, is the only certification exclusively specialized in hospital and facility inpatient coding. The CIC validates mastery in abstracting information from the medical record for ICD-10-CM and ICD-10-PCS coding. It also represents expert knowledge in the medical severity diagnosis related groups, MSDRGs, and the Inpatient Prospective Payment System, IPPS. Passing the CIC qualifies you to work in the rapidly changing medical coding and billing environment of hospital inpatient facilities. Students who earn their CIC credential go on to report services provided to patients requiring inpatient admission in settings that include general hospitals, acute care facilities, skilled nursing facilities, critical access hospitals, teaching hospitals, inpatient rehab facilities, and long-term care hospitals. And then it says CICs have demonstrated expertise in medical record review and abstract information required to report accurate inpatient coding, expertise in assigning accurate ICD-10 medical codes for diagnosis and procedures performed in the inpatient setting, superior knowledge of, they're really good with these words, superior knowledge of current rules, regulations, and issues regarding medical coding, compliance, and reimbursement under the MSDRG system and IPPS. Strong ability to integrate coding and reimbursement rule changes in a timely manner to include updating the Charge Description Master, CDM, fee updates, and the field locators on the UB04. Solid understanding of anatomy, physiology, and medical terminology required to correctly code facility services and diagnoses, understanding of inpatient prospective payment system, IPPS, and reimbursement methodologies. So the exam itself, okay, this is not, the CIC is not a multiple choice completely like how the CPC is, okay? So check this out. There's less questions on it as well, but listen to this. The CIC, 40 multiple choice questions and 7 inpatient fill in the blank questions. So there will be no multiple choice for those case studies. Those 7 inpatient cases, you have to fill in the codes, okay? 4 hours to finish the exam, and this is, of course, open book. The CIC examination consists of questions regarding the correct application of ICD-10 PCS procedure codes and ICD-10 CM diagnosis codes used for coding and billing inpatient facility hospital services to insurance companies. Medical record and healthcare documentation guidelines. This is what the CIC exam covers. So there are 7 multiple choice questions for the medical record and healthcare documentation guidelines. This also says recognize the limitations of the EHR and how downtime is handled, identify documentation deficiencies caused by copy-paste and the use of templates, explain HIPAA security and privacy, define and the reporting requirements under MDS, demonstrate the proper procedure for addendums and alterations to the medical record, identify components of the medical record, identify the requirement for timely documentation, recognize and properly code for procedures performed at the bedside, list the reporting requirements under UHDDS, and identify Joint Commission requirements for documentation. There are 3 multiple choice questions on medical terminology, anatomy, and pathophysiology. So you're going to do, in these 3, define and apply medical terminology and anatomy, identify pathophysiology to capture correct codes and identify documentation deficiencies, and recognize medications and condition diagnosis they are used to treat. And then inpatient coding, 7 multiple choice questions, identify benefits of computer-assisted coding, explain what natural language processing is and which departments in the hospital use it, applying coding clinic guidance to inpatient coding, identify correct ICD-10 CM and ICD-10 PCS codes for cases done, identify proper procedure to look up DRG, the book or the grouper, explain emerging roles for inpatient coders, DRG validator, or an auditor, and then identify conditions present on admission and the use of indicators. And then we have inpatient payment methodologies, 9 multiple choice questions, and there's a whole thing about it. The recognize proper procedure for compliance with the 2 midnight rule and certification requirements, define different bill types, identify information found in the charge master, list types of auto-population of services using a charge master. Explain requirements to maintain and monitor the charge master. Define the role each department plays in charge master maintenance. Explain the 72-hour rule and how services occurring prior to admit are reported. Identify different types of disposition and the impact on coding. Calculate base payments for DRGs. Identify elements needed to determine DRG assignment. Define what is supported in the DRG. List and explain different types of DRGs. Identify Medicare code edits. Define different inpatient types. Explain and apply guidelines for selecting the principal diagnosis and for different inpatient facilities. Explain impact of readmissions in a 30-day period. Explain when to rebill inpatient claim as an outpatient claim, and identify data submitted on a UB04. Outpatient payment methodology is also going to test you on. There are 3 multiple choice questions. So identify differences between outpatient and inpatient payment methodologies. Explain code requirements under OPPS, pass-through payments, and APCs and status indicators. Regulatory and payer requirements, 6 multiple choice questions. Review LCD and CD and apply the policy to inpatient coding. Identify services covered by Medicare Parts A, B, C, and D. Explain proper execution of ABN and HINN. Review private payer policy and apply inpatient payment. And identify pre-certification requirements. Compliance has 5 multiple choice questions. Explain external payer audits process and responsibilities of hospital staff. Explain internal audits and how they relate to compliance plans. Know how to interact with auditors during an on-site audit. Identify audit targets on the OIG work plan. Explain assert audit. Explain PEPR report. Identify examples of fraud and abuse. Explain the MAC audit process. Identify services provided for audit by the RAC auditors. Explain Medicare appeal process and discuss requirements at each level. Explain the RAC audit process and the requirements for the response to a request for records. And then coding cases, 7 inpatient cases, fill in the blank. Code the ICD-10-CM and ICD-10-PCS codes for 7 inpatient cases. Each case will have anywhere from 5 to 15 possible answers. Each answer is weighted the same. So there's less questions on this exam because this inpatient exam only has 40 multiple choice questions and 7 inpatient cases. So 47 total questions, right? But the CPC exam has 100 questions, and it's all multiple choice, and it is also a 4-hour exam. This is a 4-hour exam. So this tells you how intense this exam is if it only has 40 questions and 7 inpatient cases. Okay, so I have never taken this certification. I am not even certified with AAPC. I do get a lot of questions, even though I am certified with AHIMA. I do talk about both associations equally. I do not say that there is one that is better than the other one, because to me, it is on the caliber of the coder themselves. Everybody is different, okay? Now, when it comes to getting multiple credentials with AAPC, this is something that I do talk about a lot because I do see people get taken advantage of. There's a lot of other additional credentials, the specialty ones that AAPC has, that employers simply don't ask for, okay? Now, I have seen employers ask for the CIC. I'm seeing it a little bit more now. I used to not see it a lot, but now I'm starting to see it more, which is great for anybody who has a CIC. But they really do ask for the CPC, of course, because that's the one that says that you understand how to code in the outpatient setting. And a lot of the other specialty certifications, it's already going to be tested on with the CPC, because the CPC tests you on every single chapter in the CPT manual, right? So that's something to think about when you're starting to add on these additional credentials. Not only that, it's more CEUs, or continuing education units, that you have to put out, okay, when you start adding on additional credentials. If you just have this one, it is the CIC, it is 36 just for one. Now, when you start going up, I believe the next one is like 42 or something like that. I'm not sure. But we've talked about this plenty of times before. But I just thought that was interesting, that it's got 40 multiple choice questions and 7 inpatient cases that are fill in the blank. So you have to be prepared. This is not 100% of just multiple choice, okay? This is going to be, where you got to fill the stuff in, okay? And on those questions, again, anywhere from 5 to 15 possible answers. So you need to make sure that you are really prepared before you go in there. And they even say this as well on here. Now, it talks about for the certification requirements, please be aware that this is a difficult, high-level exam and not intended for individuals lacking CIC certification training or equivalent inpatient coding experience. So they're saying you should either have inpatient coding experience, or you should have gone through a formal program that is specifically preparing you for inpatient coding. With training and or experience, you should pass. So with training and or experience, you should possess the required understanding of inpatient coding and reimbursement fundamentals, as well as anatomy and medical terminology, to answer exam questions through careful reasoning, recall, and reference of ICD-10 CM and ICD-10 PCS codebooks. Additional requirements. If you haven't become an AAPC member, you should do so prior to scheduling your CIC exam. And again, AAPC does require all of their credential holders to maintain their memberships every single year. It is $190 every single year that you have your certification. And then if the price goes up, it goes up, okay? But you do have to maintain that membership, okay? Renewing AAPC members are also required to have current membership to sit for the CIC certification exam. The overall score of 70% or higher is required to pass the certification exam. If you do not pass the areas of study/category with a score of 65% or less, will be provided to you for your preparation to retest. The areas of study reported reflect scores based on the number of questions in each category/section of the exam. All AAPC certification exams exclusively measure proficiencies relating to the one credential named on the exam. To earn additional medical coding credentials will require you to pass additional certification exams. And then CEU requirement, certified coders are required to complete 36 continuing education units every 2 years. For CEU requirements, visit the CEU page. Now, what books do they say are approved? So the approved manuals to use for the CIC certification exam current year, ICD-10 CM and ICD-10 PCS, the publisher of your choosing. Now, if I am going to recommend what books to get, of course, I am always going to recommend Optum 360 Coding, because Optum 360 Coding books are amazing. I trust them. They are the ones that I used when I took the CCS and the CCSP and my CCA exam. So I've used them and I've trusted them. They have never let me down. The great thing about the ICD-10 PCS manual from Optum, this is a 2021, yes, I just haven't gotten my 2022. But the great thing is that every year in the back, in Appendix M, like in Mary, they have a whole list of all of the inpatient procedures, like just random ones. And then in Appendix N, like in Nancy, they have all of the answers and like some of the rationale as to why they got those answers. This was how I practiced. So this was like my practice book, like all the things that I was looking up. Of course, I did not write in my book. I'm not a big advocate of writing in your book or tabbing your book, because I believe that if you've gone through your book plenty of times, you don't need the tabs. I'm just saying. But if you're working through here, this is a great way to practice. It's a good way to get yourself familiar with the book, because again, you have 4 hours to complete 47 questions. They give you this amount of time for a reason. So that's why you have to be fast with the book. You have to be very proficient. You have to know where everything is. And I always recommend that you guys look at each and every single page of those books, so that way you can get very familiar. Now, it says that you have your publisher choice, right? Of course, AAPC is going to market their books, right? So they have the CIC Exam Book Bundle 2022. So they have the ICD-10 PCS for 2022 and the ICD-10 CM. And the retail cost is $239. But if you go with their deal, it's 50% off. So you're going to save $120. Non-members, if you don't have your membership yet, is $149 for those books. And then members is $119. Now you can go to Optum360 Coding, where they're having 50% off on these books anyway. So the price is going to be about the same. To me, I have had plenty of clients who use the AAPC books, and they don't have the same information as what I have in mind. So if they're allowing you to have your choice and you have your Wood Brothers, right? I would always recommend going with Optum360 and Optum360 for their PCS book as well as their CM book. Now this is the 2022. Now what I like about Optum360, what I like about their books is, especially for the diagnosis book, at the beginning of each section, it has examples of those diagnosis codes and how they apply at the beginning of each section. So this is also very helpful. Not something that is included in the AAPC versions. This is something that Optum360 does. Okay, and again, you can use this. So if you are practicing with your book and working with your book, this is another great way to learn those diagnosis codes. Because while like the coding is, you know, the numbers of as far as like how many questions there are for each section, it seems to be small, but think about how much they impact the exam. So it's good to know a lot of different specialties, and it's good to have that understanding, that solid understanding, before you try to go and take this exam, because this exam, like they said, is very advanced. So even I have to say that looking at it, but I haven't taken it. So, and I don't need to take it because I've already have the mastery, which is the CCS. CCS is the gold standard of medical coding credentials that's offered with the American Health Information Management Association. That's not me saying it. That's the industry that says it. You ask any employer, and they, if they're picking out people who have credentials, they do ask for the CCS quite frequently. So that is something that you should know. Now, again, if you want to stick with AAPC and you want to take this, that is totally fine. This says that you've demonstrated that knowledge of inpatient coding. And if that's what you want, then by all means, go for it. But if you decide that you want to go with AHIMA, that's totally cool too. Just think about that. You don't need them both, okay? So please don't get the CPCs, CIC and the CCS, okay? Because now you're spending more money and you're duplicating credentials. And you're spending more money duplicating credentials, all to say kind of the same thing. And people who recognize that will know. I'm just saying. So I'm going to wrap this one up. I hope this video was helpful for you. I will leave this link in the description box below. So, but to get to the question, is it easy? No, it's not easy. And again, if you have what they're looking for, the employer will look at that resume a lot quicker than somebody who doesn't have a credential that they want. I'm just saying. So now I will wrap this one up, and I will see y'all next time. Please like, subscribe, and share, and I'll see y'all again. Bye.